Hey everybody, Dr. James Fedich. I'm your clinic director here at Village Family Clinic. Doing our frequently asked questions this time. We're going to talk about carpal tunnel syndrome. So we got asked a lot of questions about carpal tunnel syndrome. What is it and can we help with it? So the carpal tunnel is right through here. So in the wrist down here, there's 8 wrist bones that make up this area, and they're called the carpals. And there's 2, 2, 2, 2, and there's a tunnel in between there. Through there is something called the median nerve. So the median nerve goes through and controls this part of the hand. So we should back up a little bit there and give a little anatomy lesson. So all the nerves in the hand come down from the brain, spinal cord in the neck. They all come out of the neck, through the shoulder, down the arm, and into the hand. So when you move or touch something here, that signal comes all the way up there and into the brain, back down as you move. So back to carpal tunnel. So the median nerve is a branch off. The nerve comes down through here and goes to these 3 fingers. So if you think you're having carpal tunnel syndrome and it's not in these 3 fingers, you don't have carpal tunnel syndrome. I can't tell you how many patients come in, they've had surgery or they did treatment or whatever happened and it was these fingers here. Carpal tunnel can only affect these fingers. There's lots of other things that can affect other fingers, but if it's anywhere else, it's impossible to be carpal tunnel syndrome. The nerve doesn't go here. So that's another nerve goes on the other side of the hand. So carpal tunnel can only affect those 3 fingers first of all. So what is carpal tunnel? So we're typing, we're doing things like this all the time. We're putting pressure on the tunnel and the nerve gets kind of trapped or swollen in there. The nerve gets swollen, it starts tingling into the fingers. In a real bad case, we'll start trying to grab stuff and we're losing strength in there and dropping things. So one of the signs we know it's getting bad, people say they're dropping their keys or dropping a pen. It's usually a sign that carpal tunnel syndrome is getting worse. So how do you know if you have carpal tunnel syndrome? Well, there's fancy nerve conduction studies and all kinds of tests like that, but one of the easiest things you can do at home is do the prayer test, we call it. So if you just hold your hands like this, and if you do this for 20, 30 seconds and those 3 fingers start tingling, it's a good possibility you have carpal tunnel syndrome. If nothing's happening when you're doing that, there's also a good possibility you don't have carpal tunnel syndrome. So it's an easy thing to overdiagnose. We all have some irritation in there. Humans weren't designed to be typing for 8 hours a day, driving, all this stuff that we do. So if you do a nerve test and you find out just about everybody has a little irritation there because we're just doing things we're not supposed to do. But that may not be why you're having tingling in their fingers. So the same nerve that goes to that finger goes all the way through the elbow. There could be a problem. There could be a problem with the shoulder. Could be a problem in the neck. Also, we found out with most carpal tunnels now is we're finding out that there's dual problems. So we call it a double crush syndrome. The way I tell patients is imagine like a garden hose. You ever go to water your lawn and you notice you get a kink in the hose? It always seems to get another kink in the hose, right? You unkink that one and the water still doesn't come out. And you're like, what's going on here? And there's always another kink somewhere else. Nerves are the same way. We call it a double crush injury. When a nerve's injured in one place, it becomes very easy to injure in another place. So we've seen this 1,000 times in the clinic. People have carpal tunnel. Yeah, you test it, it's carpal tunnel. They do surgery or treatment there. But there was a pinched nerve in the neck the whole time that never got addressed, or the shoulder or the elbow. That was really the problem. So even after they get surgery, they're not feeling much better. So number 1, if you think you have carpal tunnel, you got to figure it out for sure. You may or may not. It's very overdiagnosed. Just because somebody said it's true, not meaning it's true necessarily. Check it out. If you want to do it at home, prayer test, 30 seconds. If nothing happens, you do not have carpal tunnel, very unlikely. If it does light up or make those fingers start numbing, there's a good chance you do. Even if you do, you might have another issue. So you got to make sure someone checks you out, elbows, shoulders, and neck. Very common to have a neck issue there. Then we got to get it treated. So if it's a neck, chiropractic works great. For the wrist, one of the best things we found is ultrasound and also cold laser therapy. So carpal tunnel just means that you're getting inflammation in there. So an ultrasound machine get rid of the inflammation as well as cold laser. We have both of those here. We have 4 ultrasound machines, a couple laser machines. And then making sure the tunnel's not getting irritated. One of the best advice to give to people is wear those carpal tunnel braces. What they do is they hold this upright, the wrist closes off, like at the prayer test. So we hold it, and this is kind of the neutral wrist angle. So this is one of the big problems. We're typing like this and down even. Your wrist actually doesn't want to be straight. It's meant to be like this. So they make these braces that'll hold you up in this position. A little piece of plastic will hold you there. And really commonly at night, people are sleeping like this, and they're pinching that nerve all night long, and it's making the problem worse. So 9 times out of 10, if we wear that brace at night, we do some cold laser ultrasound, it's going to go away 9 times out of 10. Once in a while, the orthopedists do have to do the surgery where they cut the retinaculum and the carpal tunnel opens up a little bit, but I found in 15 years that's really pretty rare. So first thing, make sure you really have carpal tunnel. Make sure it's the only problem, that you don't have a neck, shoulder, elbow issue going on. Number 3, if you get some ultrasound, cold laser, wear your braces, to maybe some B vitamins, some nerve supplements can help. 9 times out of 10, it's going to get rid of carpal tunnel. If that's the only problem. The 1 time out of 10, maybe you do have to get surgery, but it's so super rare. So make sure it's not just an easy diagnosis, that you really do have carpal tunnel, and we can help you out. Give us a call.